Hi, this is Pani from Santosha Aesthetics, and today we're injecting some lips. We're actually injecting one of my favorite people, B, my front desk assistant. She's patiently awaited her turn. She's seen a lot of lip injections. Today we're gonna go ahead and give her some more height to her lips, and we're gonna give her more definitive lip border. She already has a beautiful pout. She has a good amount of volume, so we don't really wanna plump her up. We don't wanna add so much front projection of her lips, or we wanna give her definitive borders and enhance the height. So I'm gonna use one of my favorite products, Restylane Kiss, for the lips. I love this product because it has really good flexibility and it has really good tissue integration. At the same time, it is able to give us a lot of height because it has a lot of hold. I usually use smaller syringes for lips just so I could get more precision, and also it hurts a little bit less. We're cleaning with antiseptic right now. Let's get the show started. I usually love injecting at the Cupid's bow, which is the angles, the top angles of the front lip. And the reason for that is because this is what really is gonna give us that height that we want, and then we're gonna build on that. I do all different angles in terms of where my needle is, and that's gonna go ahead and help with the amount of height that we want, and also to create the definitive borders that we were talking about earlier. Went ahead and injected the top lip. I used half a syringe there. Her lips naturally have a 1-to-1 ratio. Lips are usually 1-to-1 ratio, or like a 2/3 ratio, where the bottom lip is a little bit larger than the top. For her, I'm gonna actually preserve that 1-to-1 so it could just look natural for her face. But you can tell that she is a little bit, she has more height right here in her Cupid's bow and all around laterally. But if you look at it from a side angle, she's not really protruding that much from here. It's more of coming up like that, which is the height that we wanted. And then you can also see our shiny borders, a little bit more defined than what she had before. All right, on to the bottom. Does it look even too? Is there any place that you feel like you need more? Good. Putting on a little bit of antibiotic ointment now. We're done with the process. I did a total of 1 syringe of Restylane Kiss for this beautiful young lady. Are you happy with the results?
Yes.
Yeah, okay. So not too plump, not too much projection, but we got a lot of like downward height there, upward height here, exactly what we wanted. And that's pretty much it. No makeup for 24 hours. It's really important just to prevent any kind of superficial bacterial infection. And she can go ahead and ice the area. She is a little bit swollen now, and she'll be swollen possibly for a couple days. The icing is gonna decrease the swelling, and it doesn't look like she's gonna be bruising at all. So there we go. Okay guys, so we just finished the lips. Couple do's and don'ts for after you get your lips filled. I always like icing my patients before the injections, and I let them know to ice the lips after the injections up to a day. Next couple days, they can always do warm cloth, and that also helps with any type of swelling or bruising. If you do have any bruising, I suggest not to take any anti-inflammatory medication like Motrin or ibuprofen, or any other kind of anti-inflammatory supplements like fish oils and vitamin Ds, because that's gonna increase the bruise time and the severity. I'd suggest you don't wear any makeup for 24 hours later, just to prevent any superficial skin infections, because there are a lot of injection points, so I wouldn't want any bacteria to go inside those points. And other than that, you're good to go.